Thank you so much. Really appreciate it. So let me get my slides to shareable state here for everyone. And let me hide the video panel and we'll hide the meeting control. Great. Okay, can a plan forward diet reverse chronic disease? Show me the science. This is probably one of the most important topics in all of medicine today. And I practiced medicine for almost 40 years before anybody put these two words in the same sentence for me, disease reversal. Um, we are taught, and we teach our patients and our colleagues just the opposite, that these are lifetime curses, these chronic diseases. High blood pressure, your patients will take these pills the rest of their lives, we are told. Diabetes, once on insulin, always on insulin. No one gets off insulin. Well, that's simply patently not true. These are eminently reversible disease. We get, not only can you get your patients who adopt a healthy diet, lose weight, not only can you get them off their high blood pressure medication, you have to get them off. They will stand up and pass out on you from low blood pressure if you don't. The same thing with your diabetes patients. If they lose weight and their insulin receptors open up, not only can you stop their insulin, you have to stop it or else they will have hypoglycemic reactions on you. And so many of the diseases that most doctors in primary care spend their careers treating are indeed eminently reversible, but the key is what their patients are eating, and a whole food plant-based diet is the key to this reversal, as we will explore in a minute. I thought I was going to be doing urgent care, blood and guts medicine all my career. Until midpoint through my career, I was fortunate enough to spend 8 years as an attending physician on the medical staff at True North Health Center in Santa Rosa, California. It's about an hour north of San Francisco and is in an inpatient facility. People come to True North and they stay there for days, weeks at a time, sometimes months at a time if they have a particularly recalcitrant problem with their health. And who do we get there? We get the standard variety of medical patients that every doctor has to deal with in 21st century America. The majority were either overweight or clinically obese, as are most of our fellow citizens now. And we saw rampant clogged arteries showing up as elevated lipids, elevated blood pressure, and obstructive symptoms like angina pectoris when they walked. We saw runaway type 2 diabetes in all its manifestations, and a host of inflammatory diseases involving every organ system, from lungs to guts to joints to immune system. As I tell the medical residents as I go around to the medical schools, welcome to Western medicine in the 21st century. These are the people you're going to be dealing with and their medical problems. And to cut to the chase, so to speak, I told them no matter what medical specialty you go into, from family practice to obstetrics to gastroenterology to emergency medicine, when you open the door of the waiting room to see who is waiting there to see you, who are the people that want you to help them with their medical problems, Mr. and Mrs. America, generally overweight, hypertensive, atherosclerotic, insulin resistant, and inflamed. These are the common characteristics of the people we now deal with. And at True North, we got these folks, a never-ending supply of them. And in conventional medicine, when these kind of people come in the office, as I was trained and our colleagues still do, you would put a diagnosis on them, and then you pull out your prescription pad, and you get them on the most powerful medicine you can. You raise their dose of insulin, raise their dose of beta blockers for their blood pressure, try to drive down those numbers, drive down that blood pressure with more and more medications. And if that fails, then you refer them off to the medical specialist or surgeon to see if they can do better on the medical management problem. This is Western medicine in the 21st century. That is not how we practiced at True North Health Center. Folks who came in with these same conditions, instead of raising their dose of insulin and beta blockers, we put these folks on a diet of whole plant foods. Every day, every morning, there was a big vat of fresh oatmeal with lots of cut up fruits and berries and seeds and ground up flax seeds. and a variety of plant milk, soy milk, almond milk, hemp milk. This was every breakfast, every lunch, every dinner. It had big, colorful salads, hearty vegetable soups, big plates of steamed green and yellow vegetables, and a variety of really filling entrees that we wanted them to eat all they desired. No cheese burritos, no oil stir fries, hearty stews and soups and curries and chilies. And again, no calorie counting, no carb counting, and lots of fresh fruits for dessert. This was the food stream that disappeared down these folks' gullets day after day, week after week. And the changes we saw in these folks was nothing short of spectacular. Emily came in almost 100 pounds overweight on 30 units of insulin and two medications for blood pressure. Um, we not only fed the people this low-fat, high-fiber, plant-based food stream, but we didn't want them to eat the True North food for a few weeks, lose some weight, improve their health, and then go home and resume their old diet that got themselves in trouble in the first place. We made it very clear, if you go back and you fall back into the cheeseburger and buffalo wing and pepperoni pizza land, then all the good progress you made at True North disappears. It reverses. It's shocking how quickly the weight comes back, the blood pressure goes up, the joints start hurting again. And so to prevent this, we not only taught them about nutrition, but we gave them cooking lessons. This was not to turn them into gourmet chefs. This is basic survival kind of cooking, but we taught them how to boil rice, how to make oatmeal, how to steam vegetables, how to shop, basics so they can keep this whole food, plant-based food stream going once they return home. Well, Emily sure did, and 11 months later, she sent us this picture. And Dr. Klaper not only I lost the weight, but I lost my blood pressure and diabetes. I'm off my medications, and I feel just great. Uh, Carl came in with not only some weight to lose, but runaway high blood pressure. He uh, ate lots of green vegetables. The potassium and the magnesium in the greens worked their way into the walls of the arteries, along with the lack of salt he was eating. And his arteries dilated, blood pressure came down. He spent a little time in the gym, but 20 months later sent us this uh, note and picture saying, I lost the weight and I'm off my blood pressure medication. Ali had really sore joints. In fact, he had psoriatic arthritis. He had psoriasis on his skin and on his joints. Learned how to eat plant-based. Sent us this picture 18 months later. Dr. K, I lost my weight, lost my joint pain. I'm off all my medications. Um, Elliot was quite overweight and also very asthmatic. He was using his albuterol inhaler 2, 3 times a day. Learned how to eat plant-based, spent a little time in the gym, obviously, but almost 2 years later sent us this note saying, Dr. K, lost the weight and lost my asthma off my inhalers. I have to smile when I see the commercials on TV for the weight loss programs, and the little crawler goes along the bottom there saying the above results are not typical. Well, these results are typical. This is what we expect to happen. If they don't happen, we have to go back and see what the person's really eating. But this is the routine, remarkable reversal that happens with a whole food plant-based diet and enough sleep, walk around the block every day. Um, and it's the concept of disease reversal. And this is not a California woo-woo concept. We're talking about remission of clinical symptoms. The joints stop hurting, the lungs stop wheezing, they get clinically better, but also their lab results normalize. Their inflammatory markers come to normal. Their lipid panels normalize. This is the concept of disease reversal. Most of my medical colleagues are practicing today totally oblivious that this all important concept even exists, and it is easily attainable for the expediency of working with the patient's diet. And as the years went by, I became a student of how plant-based nutrition can reverse diseases. And these 9 diseases, it turns out that most Doctors, no matter what specialty they go into, are going to spend significant amount of time treating. All of them uh, will respond either partially or usually completely reversing with a whole food plant-based diet. And at the end of this talk, we're going to take a hop, skip, and a jump through the medical literature and show you that there is more and more solid scientific support for the reversibility of these chronic diseases with a whole food plant strong diet. So why does it work? How does this food stream reverse these diseases? Show me the science. That's the topic of the talk, and I owe you that explanation. So let's explore some of the mechanisms involved in this process. We got to start with some basic anatomy and physiology. We have basically the same digestive system that our gorilla cousins have, and they spend all day shoveling the vegetation and leaves and fruit into their mouths. Yeah, I'm sure the occasional termite and grub and beetle goes down there, but the vast majority of what disappears down their gullets are whole plant foods, high carb, high fiber, whole plant foods. And they build these magnificent muscular bodies, the envy of the animal kingdom. But guess what they don't develop? They don't develop clogged arteries. They do not develop type 2 diabetes. They do not develop ulcerative colitis. Is there a lesson there for us to emulate? Not so much. The Western diet has devolved into eating cooked animal flesh 2, 3 times a day. If you don't have a piece of meat on your plate, at the restaurant, you call the wait person over and say, "Hey, where's my protein?" Now we somehow normalized that eating animal flesh 3 times a day is normal. Well, it's not. No primate eats animal flesh at all. No gorilla at least, and. Official carnivores, the tigers in the rainforest that live on meat, they don't eat flesh 3 times a day, once a week if they can get it. Yet this flesh-based, overly cooked, overly processed, salt, sugar, and fat-laden food stream has clearly become the driving force behind much of our chronic disease burden. I wish, when I was a medical resident, that some attending physician, some chief resident sat me down on the first day of my medical rotation and said, "Look, in a minute, you're going out to outpatient clinic, and you're going to see this river of people, overweight, hypertensive, diabetic, clogged up and inflamed, who want you to do something for them to help them regain their health. Well, you can't help them unless you understand why they are sitting in front of you with those bodies, with those medical conditions. So let's get real about the effect of the person's daily food choices upon the health of their body." And he would have said to me, "Look, if you eat a meal that we are advocating of whole plant food, to have a nice healthy salad with no oil dressing, bowl of vegetable soup, some steamed greens, no oil stir fries, some fruit for dessert, you have a meal like this. And if an hour later I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, I draw 5 cc's of blood into a red top glass tube and let the blood clot, put it into a centrifuge and spin it down, and then pull that tube out and have a look at it, this is what we would see. The red clot goes to the bottom. The liquid part of the blood is crystal clear. You can read newsprint through normal serum. This is what your blood should look like after you eat a meal. But you eat a standard Western meal. You have bacon and eggs for breakfast. You have a cheeseburger and fries for lunch. You have fried chicken for dinner, dairy through the day. You have a meal like this. And an hour later, I sneak up on you and draw that same 5 cc's of blood into a tube, let it clot, spin it down, and have a look. The blood tube would look like this. This creamy, milky appearance is called lipemia. The word lipoemia means fat in the blood. Lipo is fat, emia is in the blood. Postprandial means after eating. And so this is the fat in the blood after you eat. What is this stuff? It's mostly triglycerides and saturated fat, a little oxidized cholesterol. It's basically the fat of the animals you just ate. Now, not everybody shows the fat this optically densely, but everybody has a wave of fat that goes through your bloodstream after you eat a fatty meal. How can you not? Where else is it going to go? And your blood stays this fatty for a good five, count them, 5 hours. Here's Kuo's classic study. They gave someone a fatty meal at hour zero, and then drew blood once an hour for 6 hours, took those six blood tubes, put them one after another into an instrument measuring how fatty the blood is getting, and you can see the blood getting fattier and fattier and fattier and fattier. It takes the liver about 5 hours to begin to clear the fat out of the blood. And during these 5 hours, evil things are happening. Your bad cholesterol is going up. The artery walls are getting injured. The blood is more viscous. It's thicker, physically thicker. The saturated fats coat the red blood cells. They start sticking together, and it's harder to force thick, viscous blood through tiny capillary beds. It takes a higher pressure to do that, so blood pressure goes up and oxygen delivery goes down. If viscous blood doesn't deliver oxygen nutrients as well. As the fat flows through the abdominal fat stores, it sticks there, increasing obesity. We'll talk to you about the effect it has on inflammation and insulin resistance. Blood sugar goes up. And the saturated fats are pro-inflammatory. They feed inflammatory reactions throughout the body. This is what flows through the body just from the fats in these animal-based meals. And we're an affluent society. Hunger is not tolerated. If you get at all hungry in your home, you put your head in the fridge for last night's dinner leftovers. If you're out and you get it all munchy, you head for the convenience store or the restaurant. And most people are keeping their blood fatty all day. We are postprandial pretty much 24/7, except I guess when we first wake up in the morning, we haven't been eating. But this is the reality of the American bloodstream and the Canadian bloodstream and the Australian and the New Zealand and anybody eating the Western diet is walking around with blood that looks basically like this. Now I focused on the fat because it's the most visibly obvious, but there is more than fat in this blood. In fact, you eat a cheeseburger and what floods through your tissues for the next 5 hours contains these 16 molecular marauders that we'll just quickly touch on. They each stir up mischief in your cells and your tissues in their own way. And combined, I call this flood that surges through your cells after a meat and dairy based meal the red tide. And it's my term for it. But it's filled with saturated fat that drives inflammation, sugars that stick to proteins and oxidize them, animal peptides get into the bloodstream, setting off immune reaction. I'll show you what the salt does in the bloodstream and the arteries. Uh, Cooking meat and cooking carbohydrates like chips creates advanced glycation end products teeming with free radicals. The emulsifiers keep ice cream soft in your mouth, but they also dissolve the intestinal lining mucus on the surface of your small gut. Cooking the burger, broiling the steak oxidizes the cholesterol, and it's the oxidized cholesterol particles that are the most atherogenic. I'll quickly run through these other meat-based marauders in a minute here, but this surges through your bloodstream for 5 hours after every meat and dairy-based meal. It's a fatty tide, it's a salty tide, it's a sugary tide. It sets off immune reactions, so it's antigenic. It's full of phosphates and sulfates that form sulfuric and phosphoric acids that your kidneys and bones have to neutralize. It damages your DNA. It's mutagenic. Sets off cancers. It's carcinogenic. It sets off plaque in the artery walls. It's atherogenic, pro-inflammatory, disrupts enzyme reactions throughout the body. This is the disrupting influence of the Western diet. People say, well, I don't eat the fast foods. I don't eat those white flour burgers. Okay, fair enough. Here, if you just eat a pure paleo diet, you just broil a steak and have some non-starchy vegetables, you are still getting the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 of these inflammatory disrupting molecules flowing through your tissues on a quote clean carnivore or paleo diet. I mentioned it's a high salt diet. It sure is. There's salt in the meat, salt in the cheese, salt in the fries, salt in the chips, salt in the spaghetti sauce at the Italian restaurant, in the processed foods, in the the frozen dinners, and it's already in these foods. You can't regulate it. People say, well, we don't use salt shakers at our table anymore. Actually, that's the one place you got control over it. A pinch of salt on the surface of your veggies is you get a big salty hit for very little actual sodium. That is the way to use it. It's the processed foods that load you up with sodium, that stiffen your artery walls, raise your blood pressure, sets you up for congestive heart failure, atherosclerotic vascular disease, myocardial infarctions, heart attacks, cerebral vascular accidents, strokes, chronic kidney disease leading to dialysis, and and who knew? But high salt diets trigger immune cells that open the door to lupus and autoimmune disease. Who knew? But as a recovering saltaholic myself, I'm starting to well, I'm learning how to entertain my tongue with non-salty flavorings. We use lemon juice and lime juice over most of our foods. We use balsamic vinegar on our veggies and salads. We add celery juice to the soups instead of salt. There's a wonderful salt-free but very salty flavored product called Benson's Table Tasty. I have no connection with the company whatsoever, but it's just been a wonderful addition to our table, and you can order it off the internet. Excellent way to reduce your sodium intake. Then there's sugar. Now I'm talking about a teaspoon of maple syrup in your tea. That's the proper use as a flavoring. I'm talking about eating sugar as a food. If you eat a vegan donut, if you eat a candy bar, cookies, drink a cola drink, you are flooding your tissues with grams and grams of fructose, dextrose, maltose, and these sugars stick to proteins all over the body. And they glycosylate them, and your own body heat will then oxidize these glycosylated proteins to form these advanced glycation end products, AGEs. Um, uh, they are teeming with free radicals that rip up proteins and cell membranes around the body. They rip electrons off your tissues. Um, and um, and it's one thing to, it's bad enough to put carbohydrates, potato chips into hot oil and create these advanced glycation end products. But boy, you're sure to want to create these advanced glycation end products um, in your own tissues because they age you. The acronym is accurate, AGE, it ages you. You don't want to form these AGEs in the crystalline proteins of the lens of your eye. Great way to open the door to cataracts. You don't want to form these AGEs in the elastin fibers of your skin. It's a great way to turn your skin into an old suitcase. And you sure don't want to run this reaction of oxidizing these glycosylated proteins and forming AGEs in the lining of the blood vessels in your brain. Why? Well, here's why. Here is the arteries of two men who died at the same age. The man in the upper panel did not have Alzheimer's dementia. The man in the lower panel did have Alzheimer's dementia. And you can see the man with the Alzheimer's disease how thickened and edematous his brain arteries are. And if you stain for these AGEs, you'll see that those artery walls are filled with them. Alzheimer's disease is not something that falls out of a tree on you at age 60. It's from 60, 70 years of running the red tide, molecular marauders through the arteries in your brain. There are other issues, that causes deposition of amyloid and tau protein, all this stuff. But there's a huge vascular component to Alzheimer's disease and these AGEs, the sugars, and meats. When you cook meats, when you broil the steak or fry the chicken, or grill the fish, you get even more AGEs than cooking the carbohydrate, making the potato chips. Cooking meat produces the highest amount of AGEs. So I lingered here, you can really hurt yourself with vegan junk foods. But most of your patients and most of your friends and relatives, they're not vegan, okay? They are eating animal flesh 3 times a day. And if you have meat in your diet on a regular basis, you are adding these 10 layer, a whole new layer, a whole new tier of meat-based toxins, if you will. Let's quickly go through them. Oxidized cholesterol. No one eats raw meat. And the very act of grilling the burger, frying the chicken, broiling the steak oxidizes the cholesterol. To oxidize is to rip an electron off of it. And I'll show you what oxidized cholesterol particles look like in a minute. But they're the most atherogenic. They're the ones that burrow into the walls of the artery, setting off atherosclerotic plaque formation. We'll talk about reversing this. When you broil the steak or grill the burger, you are oxidizing the nucleic acids and the glycogen in the animal's muscle. That's going to create reactive aldehydes that are mutagenic. They damage your genes. Okay, man, you're just having lunch. You don't want to be damaging the DNA in your cells, but if you're eating cooked meats, you are eating these reactive aldehydes that inflict damage to your DNA in your cells. This is the DNA that calls forth the enzymes in your cells so you can do your vital biochemistry there. Well, eating cooked meat has these mutagenic compounds in it. Steaming broccoli does not create reactive aldehydes. Boiling rice does not create reactive aldehydes. Cooking any plant food with water is safe. But when you cook animal flesh at high temperature, you create these problematic molecules. Nu-5GC is a sialic acid that only animals make, and it drives inflammatory reactions throughout the body. And our paleo friends and our carnivore friends are giving themselves a jolt of Nu-5GC 3 times a day, keeping those inflammatory fires smoldering in the walls of their arteries. Endotoxin. What is endotoxin? Well, and where does it come from? Anyone who's ever spent time in the intensive care unit has seen people dying of endotoxic shock. What is it? Where does it come from? It comes from the slaughterhouse. All animals pass through the slaughterhouse, even organic grass-fed beef. And as the carcass is eviscerated and the digestive system is removed, you inevitably get spillage of the gut contents. And you can take a culture tube swab from any and swipe any cutting surface in the meatpacking plant, and you'll get a luxurious growth of bacteria like E. coli, Salmonella, Shigella, Enterococcus, Listeria, Pseudomonas, the whole rose gallery of bacteria from the gut. And there's a thin layer of these bacteria that coat every steak and chop and chicken breast that leaves the meatpacking plant, wrapped in clear plastic, sent to your supermarket. And in the meat case, the ultraviolet light shines down and kills the bacteria. Yay! But as these bacteria die, their cell walls break apart, and those fragments are lipopolysaccharides called endotoxin. Nasty stuff, endotoxin. Take a little walk around this daisy of death and see what endotoxin loose in your bloodstream does. Releases free radicals, it depresses your heart muscle, releases histamine, makes your blood clot. And endotoxin is heat stable. It's already mixed into the burger from all the different cows that have contributed their flesh to that ground beef. And grilling the burger does not get rid of the endotoxin. Endotoxin is heat stable. And guess what? Endotoxin makes your gut leaky. It increases intestinal permeability. It allows undigested food proteins and bacterial cell walls to leak into the bloodstream, flow through joints and other tissues, setting off immune reactions. This is what the endotoxin does. You sure don't want endotoxin loose in your bloodstream. Is there anything that helps endotoxin move from the meat to your bloodstream? Sure, saturated fat does that. Now, why? Now, the endotoxin's in that burger, it's already in there, and grilling it didn't get rid of the endotoxin. Um, what might help the endotoxin move from the burger out into your bloodstream? Saturated fat. Why are you eating the burger? Because it's so juicy. Why is it juicy? From all the saturated fat. So the very fat that's making you salivate and eat that burger is the very fat that's moving endotoxin into your bloodstream. It's clearly a malignant synergy. Um, Trimethylamine oxide builds up in the blood from the bacteria that your meat and egg-based diet has summoned up in the gut. And trimethylamine oxide drives cholesterol into the artery walls and keeps your good HDL from removing it. When you broil the steak, grill the burger, you inevitably are producing cancer-causing substances that smear on the stomach wall, giving gastric cancers, smear on the colon wall, giving GI cancers. The meat eaters have far greater cancer risk than the vegans do. Heme iron makes red meat red. It also increases the risk of strokes and cancers. I don't have time to go into the mechanisms, but our macho red meat guys, oh, I get absorb more iron. Well, they set themselves up for iron overload because they can't get rid of it, and that increases the risk of strokes and cancers. Again, grilling the burger produces AGEs that promote tissue aging. The animals in the feedlot are fed bushels of grains that are sprayed with pesticides and herbicides. They drink water with cadmium and mercury and lead in it. They're given hormones and antibiotics as growth promoters. All these substances bioaccumulate in the animal's flesh. So by the time you bite into that burger or that finger licking good chicken, you're eating all the concentrated toxins that animal was fed during its life. And now the curse of microplastics. The whole world is filled with microplastics that are breaking up in the hot sunshine, including fishing nets and plastic bags out in the ocean. They break up in these tiny microparticles that the little fish, the anchovies, and the sardines eat, and they're eaten by the bigger fish, and then the predator fishes, the salmon and the tuna, eat them. And so the microplastics build up in these animals' flesh. So the fish eaters get a significant amount of microplastics in every fish fillet. But you say, well, I don't eat fish. Well, you're not protected if you're an omnivore. Why? Because half the fish catch in this country is ground up and added to animal feed. It's added to cattle feed and chicken feed and pig feed with the microplastics that then are eaten by the cows and pigs and chickens and concentrate in their flesh. And it's estimated the average omnivore eats up to 5 grams of microplastic a day. That's the weight of a credit card. I'm sorry, this should be 5 grams per week. I'm sorry, I have to change that. But every week, people are eating a credit card full of microplastic. This is what is inherent in the standard Western diet. So if you're eating broccoli, rice, and beans, you're not getting any of these and probably minimal, hopefully, microplastics. And do the math. If you eat one of these kind of meals, a meat-based meal 3 times a day over the course of a year, that's over 1,000 times a year. You flooded the red tide through your tissues, and it's the constant repetition of this mixture through your tissues that causes the damage. And the fuel, clearly, far from the gorillas, foliage that they're eating, this full of oxidized animal muscle is oxidative, it's allergenic, full of endotoxin, U5GC. It causes inflammation in the tissues, which will eventually cause dysfunction of liver, kidney, gut membranes, etc. And if you it's the wrong fuel. And if you put the wrong fuel in your car, what's going to happen? If it's a gasoline burning engine, then you put kerosene in a diesel fuel, you can't be surprised when the spark plugs clog up and the catalytic converter is destroyed. Well, we get these diseases as well. And I tell the medical students and the medical residents, this is going to show up in your clinical practice. When you're in your office or outpatient clinic or the emergency room, and you open the exam room door, and there's the man with the crushing chest pain from the plaque in his coronary arteries. You have the woman with asthma pulling on her albuterol inhaler. See the man with the type 2 diabetes injecting insulin. You see the woman with her acne scarred skin. And you ask the professors, now, or look in the textbook, what's the cause of these diseases? You run into 2 words, etiology unknown. We have not determined the final cause of atherosclerosis or asthma. And it's true. We have not teased out every last interaction between every gene and every enzyme. And there's a world of discoveries waiting to be made on that level, new medications, and bless those researchers probing these mysteries. But to say that we have no idea the cause of clogged arteries, autoimmune asthma, type 2 diabetes, and insulin resistant and inflammatory skin disease um, is patently untrue. Uh, um, Is this not the effect of repeated postprandial red tides flooding through these people's bodies? Is this not 65 years of red tide damaging this man's coronary arteries? The only equation I'll give you in this talk is the food effects over time equal the health effects, and we have to stop kidding ourselves. That the patient's diet has no effect on these diseases, yet that is how medicine is practiced these days. We never ask about the patient's diet, never even enters the equation. Well, the patients eventually get to that point where they demand some help. You get that point where they're getting out of the morning shower and they catch a glimpse of themselves in the bathroom mirror and they don't like what they see. Especially when they step on the scale, they don't like their protruding abdomen, they don't like their sore swollen joints, they don't like the medicine cabinet full of pills, and they show up in your office saying, "Doctor, what can I do to get my health back?" Well, hopefully, as I'm going to the nation's medical schools and trying to awaken to the patients the importance of their patient's diet, the nutritionally aware physician, which we are trying to create across the country, will tell the patient the first and best thing to do is start consuming a food stream of mostly whole plant-based foods, okay? The food that they serve at True North, start running that through your bloodstream on a daily basis. If the patient is able to say, "Okay, doc, I'm convinced," and not everybody does this, and some people have to ease into it, some people have to taper, that's fine, as long as they're moving in that direction. But let's just say, for the sake of this argument, that the person said, "Doc, I'm so sick and tired of being sick and tired. I'm done with the animal flesh eating. I cleaned out my fridge. I went shopping. I got lots of rice and beans and greens and fruits and vegetables. Um, I'm willing to jump on the plant-based train, boots in, as they say in New Zealand, fully committed. I'm boots in, Doc." Um, if they're able to make that complete change, and even the folks who get there gradually, they're able to make the change, here is the good thing that happens. First and foremost, the red tide stops. There is respite. Every tissue in your body, every cell in your body has instructions on its DNA on how to repair any damage. Do you know that in every one of your cells, along your DNA strands that lie unfolded with your genes exposed, you have globular proteins that spend all day going up and down your DNA strands 24/7 looking for damage and mismatched nucleotides in your DNA strands. And when they're called DNA editing enzymes, and when they find the damage, they repair them, they fix it. Don't have to ask your permission. They just fix your DNA 24/7. When I read about this in medical school, I put the book down and I applauded. This is so brilliant. Um, well, those repair enzymes cannot function optimally if every 4 hours you're still eating the red tide foods, and every 4 hours there's this flood of AGEs and phosphoric acid and high fructose corn syrup and animal peptide. Your repair enzymes can function optimally. Now, when the red tide stops, the repair can kick in. And as the plant-based food stream now becomes the daily fare, look at what now floods through the tissues as these molecular marauders are replaced by the plant-based constituents. This is the most important slide in the presentation. Can a plant predominant diet reverse chronic disease? It sure can, and here is how it does it. First of all, as I said, the red tide stops. That's the number one factor that allows repair to happen, allows reversal to happen. But now, it turns out now you change to a high water content diet. All the soups and the salads and the steamed vegetables and the fruits are full of water. And as more water comes into the bloodstream flows more easily. The blood viscosity goes down. The folks who exclude meats had significantly lower blood viscosity. It's a more free-flowing bloodstream. So that brings a surge of blood through the capillary beds in the brain, heart, muscles, kidneys, filled with oxygen and nutrients. But also, a wonderful positive synergy kicks in because now all the dark green vegetables you're now eating, all the kale and broccoli and Brussels sprouts and chard, all these have lots of nitric oxide, will uh, promote the production of nitric oxide in the walls of the arteries. And that allows the walls of the arteries to relax and dilate. And as a result, you get this subtle vasodilation, which will certainly lower the blood pressure as the pipes get wider, the pressure in of the liquid in the pipes comes down. But also, as the arteries dilate from the nitric oxide just a little bit, this law in physics kicks in called Poiseuille's law. And Poiseuille's law says that the volume of liquid, the amount of liquid flowing through a tube, including arteries, blood flowing through an artery, but the amount of liquid flowing through a tube will increase by the fourth power of the increase of the radius. And that means that if the artery wall expands by a factor of two, the radius increased by a factor of two, the blood flow going through that artery will increase by a factor not of two, but by 2 to the 4th power, by 2 times 2 times 2 times 2 by a factor of 16. And you know this in the real world. If you're trying to suck liquid up through a skinny straw, a straw even twice as wide diameter gives you a whole lot more liquid for a whole lot less sucking there. That's Poiseuille's law. Well, that kicks in the bloodstream as well. And we'll show you examples of that. But you get this surge of oxygen and nutrient-rich blood flowing through the capillary beds thanks to the dilated arteries. When you pull the animal flesh out of the diet, you're pulling out a substance called arachidonic acid, which is the main driver of inflammation throughout the body. Now all the fats are coming from plant oils, many of which are in the omega-3 family that have an anti-inflammatory effect. And as the omega-3s go up, inflammation comes down. And so you've changed the entire inflammatory balance of tissues throughout the body from a pro-inflammatory one to an anti-inflammatory one. And now knowing how much inflammation drives so many chronic diseases, from arthritis to depression, it's so important that we are changing the tissue milieu from a pro-inflammatory to an anti-inflammatory one just by changing the diet from an animal-based one to a plant-based one. All the ROS stands for free radical, reactive oxygen species. These are those free radicals that are missing an electron. They are molecular terrorists. They will rip an electron off any of your molecules of DNA or cell membranes. Well, they're there mostly because of the processed foods, the French fry oil, the oxidized sugars, the oxidized cholesterol are filled with free radicals, the advanced glycation end products, and that produces oxidative stress by ripping electrons off the surrounding tissues. Well, all the colorful fruits and vegetables you're now eating are colorful because they have molecules that neutralize free radicals, that are antioxidants. So you've quenched the oxidative uh, uh, propensity of tissues throughout the body. That is huge. The tissues are now more stable and less oxidized. That creates health on a cellular level. If you change the food stream flowing through the gut, you're going to change the microbes that live in that gut. If you are eating meat and eggs, you are fostering the growth of some unfriendly microbes in your gut wall from the Firmicutes phylum, not friendly fellas. They put out byproducts that irritate the gut wall, promote cancer growth, promote inflammation. Well, you pull out the meat and the eggs, and now all the food material coming down are from plants and full of high fiber and resistant starches. And that's going to foster the growth of good bacteria, beneficial bacteria from the Preventella family. And these are not only more benign in your gut, they put out anti-inflammatory substances and they inhibit cancer growth, but also the side effects of many of these microbes, the byproducts, are feel-good chemicals. They put out molecules like serotonin and norepinephrine and dopamine and oxytocin that find their way into your nervous system. And people often say, gee, ever since I went plant-based, I'm a little happier, I feel better. That's not a placebo effect. That's a gift from your refurbished bacterial microbiome in your gut there. When you stop eating other animals' cholesterol, your own lipids are going to become less atherogenic, less likely to promote clots or plaques in the artery wall. You're going to be absorbing less endotoxin. You're going to be absorbing no endotoxin because you stopped eating slaughterhouse meat. Your skin oils become less smelly. I've had many guys say, "Hey, my wife said ever since we went plant-based, I don't stink as much." Yeah, the animal fats in the meats and the dairies work their way out into the oils of the skin and oxidize and create that macho locker room smell. Well, the plant oils don't do that, and so skin oils often become much less irritating. The cows in the dairy are all pregnant these days. It didn't used to be, but now modern dairy milk is filled with female hormones, estrogens, progesterone, estrone, estradiol, and this gives women breast lumps. It gives them fibroids and make them bleed and need hysterectomies. Gives guys man boobs and unstable prostate glands that can go malignant. Well, if you convince yourself you're not a baby calf and you stop consuming baby calf growth fluid, these growth promoting hormones decrease. Kidney function is important, and high protein diets that are all the rage now are not friendly to the kidneys. When you eat meat or even these protein powders, 100 grams of whey protein, all these amino acids slam into the kidney filters and make them go into a state of hyperfiltration, and they thicken, and over time they can lead to chronic kidney disease and dialysis. Uh, Kidney function improves on a plant-based diet. The asthmatic folks notice they don't wheeze as much. Their mucus in their lungs becomes thinner and less likely to make them have an asthmatic episode. Their white blood cell counts start coming down, not because they have bone marrow failure, but because they're not praying their bone marrow with endotox 3 times a day. These are just some of the profound changes that affect fundamental systems throughout the body. So much so that if someone asked me, doctor, in a word, what changes when one moves the food stream from an animal-based food stream to a plant-based food stream? What changes in the body with that alteration of food stream? Everything changes. It is a totally different physiology. The blood viscosity is different. The microbiome is different. Hormone levels are different. The oxidative levels in the tissues, the inflammatory balance, everything is different in the body. This is what allows those amazing before and after pictures that I showed you to happen. Knowing that this is the state of the body, no wonder they lose weight and their bowels start working and they function better. It's what every antelope and giraffe knows. Plant-based foods make you lean and healthy. I could spend 3 lectures going through each one of these organ systems, showing how they benefit from the change to a plant-based diet. But can you get enough protein? Absolutely. The Mother Nature can't make a kernel of corn or a lentil without using all the amino acids. There is no incomplete plant protein. And the beans and peas and chickpeas and lentils and nuts and seeds and grains are filled with protein. You have 3 meals a day of whole plant foods. It's easy to get 70, 80 grams of high grain protein or more. So we're going to take a look at 2 conditions and show you the actual reversibility of them. And there's clogged arteries and type 2 diabetes. Uh, Whoops, every day in Canada, 14 Canadians die of a heart attack, and over 1,000 Americans die every year, every day. We have 300,000 people die of heart attacks every day. Is it just a matter of bad luck and he didn't take his statins? No, what's happened is that a plaque in the artery wall has torn open and the exposed cholesterol, oxidized cholesterol, sets off clot formation that stops the blood flow downstream. And and that makes the heart muscle die. This doesn't happen all at once. Over the years, the red tide injures the artery linings. Here you see the cooked animal muscle and the AGEs and the fryer oil and the uric acid from the meat and the fructose and the desserts. All these rip up the endothelial lining of the artery walls. And I mentioned oxidized cholesterol. Cholesterol is not an evil molecule. Your liver is making it right now because we need it for hormone production and membrane stabilization. And this is the normal, natural normal cholesterol molecule. But it's easy to rip electrons off of it. It's easy to oxidize it. And just storing the meat in the fridge, it oxidizes. You lose electrons. And when you chew it up and drop it into your stomach acid, you oxidize more cholesterol. But it's the cooking, it's the grilling the burger, it's the frying the chicken, it's the broiling the steak that really oxidizes the cholesterol and turns it into cholesterol peroxides. And these are the atherogenic particles. When we talk about oxidized cholesterol, here they are. And there's getting to be a strong medical literature supporting the role of oxidized cholesterol. That's these red balls here, and they work their way into the walls of the arteries. They're taken up, and they produce plaque formation. Now, most cardiologists believe this is a relentlessly progressive disease. They use those two words, relentlessly progressive. Oh, they're all going to need statins. They're all going to need stents. They're all going to need bypasses. That's right, doctor. You don't talk to them about what they're eating. If you don't help them change their diet to a plant-based one, that is what you're going to see. But it doesn't have to be that way. Now, this is a reversible disease. Dr. Caldwell Esselstyn and others have clearly shown that you can melt these plaques away. What is Dr. Essel's program? It's a whole food plant-based diet, and most importantly, the red tide stops, okay, with a whole food, 100% plant-based diet. Plus, we want you to have a helping of greens 2-3 times a day. Why? Well, here's why. Here we are back in the artery wall here. Here's the oxidized cholesterol coming in, but the person jumps on Dr. Esselstyn's program, goes plant-based. Now the red tide stops, the oxidized cholesterol stops coming in. And because you're eating the greens several times a day, they're always in your intestine and they're acting like time release capsules, steadily releasing antioxidants into the bloodstream 24/7. And as the weeks go by, the antioxidants work their way into the walls of the artery. They find free radicals there, they neutralize them, and as a result, the foam cells making up the plaque, they leave, they outmigrate, and the plaques get smaller and smaller and smaller, and the endothelial lining reestablishes itself not by magic, but because the bone marrow is putting out showers of stem cells constantly that reupholster the artery walls like new paving stones. And as a result, many of you have seen these films, but you get dramatic improvements like this. This is the artery in a man's heart, the left anterior descending artery. It's filled with angiography dye. Now, the entire artery should be about this wide going all the way down, but this rat-eaten portion here, these are atherosclerotic plaques encroaching into the blood flow channel, and and this man had severe angina when he walked. He did not want statins or stents. There was no place even to do a bypass. He was so clogged up. So he went on Dr. Esselstyn's diet program, and day after day, soup, salad, steamed veggies, a daily walk around the block. The plaques melt away. 29 months of that food stream, and this artery turns into this artery. Same patient, same artery. You can see how reversible this disease is. Can a plant-predominant diet reverse chronic disease? Yes, it certainly can. Here's the proof right before your eyes. And once those plaques begin to melt away a little bit, and once those arteries healthy up a little bit, the arteries dilate a little bit, and guess whose law kicks in? Poiseuille's law kicks in, and so blood flow increases dramatically. This is a cardiac perfusion scan. This is the heart. This is the blood flow in a heart muscle. Red is good blood flow. You can see how choked down his blood supply is here. He went on a whole food plant-based diet for just 2 weeks, 14 days. And the plaques melt away a little bit and the arteries open up just so they dilate a little bit. Poiseuille's law kicks in, and this perfusion scan turns into this perfusion scan in just 2 weeks. You get these dramatic improvements surprisingly quickly, and we saw that at True North predictably. I first saw this report in 1977. A 65-year-old man had severe angina from clogged arteries in his heart. He had to stop every 9 or 10 paces to let the pain go away. Went on a plant-based diet. 6 months later, he's climbing mountains in the Lake District of New England. Again, this is not an abnormality. This is what can happen frequently as the plaque begins to melt away. And arteries all over the body open up, much to the delight of people at home. I'm sure this woman is delighted that his retinal arteries in his eyeballs have increased the blood flow, so his vision improves. But seriously, blood flow to genitals and all organs will improve as arteries all over the body open up and the plaque melts away. And I mentioned there's getting to be a burgeoning literature substantiating the benefit and the reversibility of atherosclerotic disease with a whole food plant-based diet. High blood pressure, heart failure, even kidney failure improves on a whole food plant-based diet. And it forces the doctor to learn this wonderful skill called deprescribing. You got to learn how to get people off these medications, and it's a great skill to have to learn. So indeed, the biggest killer, cardiovascular disease, is certainly reversible. How about type 2 diabetes? How about insulin resistance? When people hear diabetes, they say, oh, sugar, sugar, it's that bad sugar, stay away from the sugar, low carb, eat low carb, don't eat those carbs. The problem, folks, is not the carbohydrates. That's the tail of the dog. The problem is not the sugar, it's the saturated fats in the diet. Now, how does that work? Here is schematically, here's a muscle cell. It burns glucose as its primary fuel. And so when you eat an apple and sugar shows up in the bloodstream, the pancreas in response releases insulin molecules that engage with the insulin receptor. And that sends a signal to let the glucose into the cell to be burned by the mitochondria. But if you're eating a standard American diet and you're keeping your blood fatty all day, the fat works its way into the muscle cells and the liver cells and deposits there. It's called intramyocellular lipid. Intra is inside, myo is muscle, cellular is cell. So this is lipid is fat. This is fat in the muscle cell. It doesn't belong here. It is not a theoretical concept, folks. Here's what it looks like under the light microscope. This is striated muscle in a certain person's calf muscle. And you can see all this black stuff. This is intramyocellular lipid. This is fat in the muscle cell. Doesn't belong there. Here it is under the electron microscope. Fat in the muscle cell. Doesn't belong there. And here's why. As I mentioned, normally when sugar shows up in the blood, and insulin engages with the insulin receptor, it activates two kinase enzymes here that activate the glutathione transport mechanism that pulls sugar into the cell. That's the way it's supposed to work. But if the cells are all loaded up with fat that then oxidize and turn into free radical, these two kinase enzymes don't work. So insulin knocks on the door, but nobody answers. And so the sugar piles up in the bloodstream, causing its own problem. High sugars are not healthy, but it's not primarily the problem from the sugar, it's the fats, the saturated fats, clogging up the insulin receptors. There's getting to be a strong literature supporting this. Well, there's another aspect to this. Here we are back in the muscle cell, and here's all the intramyocellular lipid clogging up the enzymes of the insulin receptors. This is just from the fat in the muscle cell. But if you or your friend or your patient happens to be obese, that fat in the abdomen is not inert. The fat in the abdomen is metabolically active and it pumps out inflammatory molecules, cytokines like interleukin 1 and interleukin 6 that drive inflammation throughout the body. It's called metabolic inflammation. Obesity is a state of inflammation. People say, we need fat acceptance. You can be healthy at any weight. Not in my book. Obesity is a state of inflammation. That fat is pumping out inflammatory cytokines that play a significant role in insulin resistance. And here it is schematically. Again, here's the insulin receptors clogged up from the inside. by the intracellular lipid, but they're interfered with from the outside by the inflammatory cytokines. No wonder so many obese people develop type 2 diabetes. They are clogged up on the inside and the outside of their insulin receptors. Well, here's that magical transformation. Stop eating all that saturated fat, adopt a diet of whole plant foods, and guess what happens? It's a reversible disease. The fat that's in the muscle cell, because it's a low-fat diet, gets burned for energy. The inflammatory cytokines disappear. The insulin receptors open up. The person's own insulin starts working fine. And as a result, when you compare the plant-based diet to the American Diabetes Association diet, the folks in the plant-based diet, their blood sugars improve more, they lose more body weight, their lipids improve more, their kidneys heal, they lose less protein in the urine. Jim was a patient, over 100 pounds overweight on 28 units of insulin, went whole food plant-based, took him almost 2 years, but wrote us a letter, Doc, I lost the weight, and guess what? I lost my diabetes. Now I'm running marathons without insulin. This is what we expect. This is not unusual. It's what's supposed to happen. And again, it forces the doctor to learn how to de-prescribe insulin, a great skill to have to learn. In this age of Ozempic, I just have to shake my head, at $1,000 a month, all sorts of side effects, and it doesn't cure obesity. You wind up, after 6 months, the weight loss plateaus off. You stop losing the weight. And if you stop the Ozempic or the Wegovy and you keep eating your burgers and buffalo wings, the weight comes right back. And it's all unnecessary. All you need to do is adopt a diet of whole plant foods. Mother Nature, in her wisdom, made vegetables and fruits essentially out of fiber and water. When you've got a helping of broccoli and rice and beans on your plate, chemically, that stuff is mostly fiber and water on your plate, and it doesn't stick to you. You pee out the water, you poop out the fiber, it passes through. You have these nice, soft, easy to pass bowel movements, and the weight comes off. It's all fiber and water. If you go back for a third bowl of vegetable soup, who cares? It doesn't matter. You go back for a fourth helping of salad or kale, who cares? It doesn't matter. It's guilt-free eating. It's no carb counting. It's joyous eating. So, and if I tell my colleagues, if you're going to be giving a prescription for Ozempic or Wegovy, hand it to the patient. This is a time-limited 6-month prescription. Now, if you want this drug, okay, but the contract is during this 6 months, you will learn how to make a whole food plant-based diet food stream happen in your life and get on that. So when you stop this at 6 months, the weight loss will continue and you'll stay healthy. That's how these drugs should be used. Studies showing that whole food plant-based diet reduces weight. We know that. It's an anti-inflammatory diet. It helps reverse autoimmune diseases. If you have anybody with lupus or ankylosing spondylitis, please have them get this wonderful book by Dr. Brooke Goldner, an MD who reversed her own lupus with a whole food plant-based diet. The red tide is not friendly to the gut wall as it sloshes through the intestinal tract. It's highly irritating and pro-inflammatory, and it sets off inflammatory diseases like Crohn's disease and ulcerative colitis. Now, pull this stuff out of here with a plant-based food stream. And it turns out that it's step one in reversing these diseases. And it's not all that's needed, but it allows you to taper off the prednisone and the methotrexate without these people flaring up again. It's step one in reversing these bowel inflammation conditions. The asthmatic folks wheeze less, especially without the dairy protein. Sorry about that. Let me pull this back here. The folks with the inflamed skin, the psoriasis, and the eczema often notice great improvements. Do you have to eat 100% whole plant foods? No, but I'd rather you have if you're going to eat animal flesh, first of all your foods, all your meals should be whole food plant-based. But if once or twice a week you want to put it on a piece of animal flesh, okay. But again, I'd rather you eat it twice a week than 2-3 times a day. And some people may need, if they have a real physiologic dependence on animal flesh, they need to taper. They may need to taper it off for a few months. That's fine. Just steadily increase the interval between eating the portions of animal flesh. But my colleagues were totally oblivious. We never mention it to the patients or to our colleagues. Our job is get them diagnosed, put a name on their disease, and get them on the right medication or refer to the proper specialist. And so it leaves patients asking, why does my doctor talk to me about what to eat? Why not? We're not taught anything about nutrition. 4 years of med school goes by. It's never even mentioned, essentially, outside of scurvy and diseases we don't see anymore. It's not respected. It's a sissy science. It's looked at, nutrition, send them to the dietitian. I'm up in the operating room doing real medicine. But what are you doing up in that operating room, doctor? You're dealing with the infections and the infarctions and the amputations from what your patients are eating. They could be reversed in the outpatient clinic. Plus, the young docs are eating the same burgers and pizzas in the hospital cafeteria. So we don't mention diet to the patient at all. Business as usual. Diagnose them, treat them, get them out. Well, business as usual in the healing professions is a losing proposition. Now, the patient certainly loses big time. They lose a chance to actually reverse their disease. I get to lean across the desk or into talking to my cyber screen and say these blessed words that my conventional colleagues never get to say. How'd you like to get rid of your diabetes? How'd you like to get rid of your high blood pressure? How'd you like to get rid of your lupus? And they're offering them a new lease on life. Well, if you ignore the patient's diet and keep letting them eat the standard Western fare, they lose that chance. The doctor loses the chance of seeing their patient regain their health and heal on the deepest level. It's such a ripoff on the doctors. The healthcare system loses billions, trillions of dollars where you spend all this billions doing these dramatic rescue procedures, open up their chest to a coronary artery bypass for what? So that they can head right to the local rib joint and start eating the burgers and fries and ribs that clog their arteries up in the first place. That money could be used to fix the roads, send kids to scholarships, put internet in everybody's house. It's a waste of money to keep treating these chronic diseases while dealing with the cause of it, the patient's diet. Society loses every time a breadwinner goes down with a heart attack or a stroke. We lose a creative, healthy, productive citizen, but we also lose a taxpayer. We have to shoulder their burden. The farm animals lose big time. 80 billion living creatures get their throat cut every year on this planet because we love the way their flesh tastes, not because we need it. And the planet loses because industrial animal agriculture is the driving force behind why we're cutting down the forests, why we're sucking the rivers dry, why we're polluting our soils, and why we're causing these droughts and wildfires. Yeah, ignoring the patient's diet, ignoring our own diet is a major losing proposition. And when I talk to my colleagues to even mention diet to them, I get these three responses. Listen, I don't know what to tell them about nutrition. I was never taught about it. I don't get paid to do this counseling. I don't have time to do this counseling. I tell them the good news is you don't have to, doctor. There are trained professionals who will love to do this counseling for you. Every city I go into and lecture, I check for plant-based dietitians. They're getting to be more and more of them in every city in the country who will happily uh, uh, do this counseling. And it lends itself to telemedicine so beautifully. They don't even have to be in your office, let alone the same city. As long as they're in the same state with their license is valid, they can do the counseling for you. Even in Canada, there's getting to be plant-based dietitians. And so, what I'm trying to instill in the doctor's mind, especially the young doctors, don't rock the boat when you're in med school. But once you're out in your own practice, make a connection with a plant strong dietitian. And when you see your patients in clinic, practice good medicine. Do your medical history, do your physical exam, order your labs, get them on medications if you need to. But say, before I lose you on this visit here, I want you to connect with Miss Jones in room 421 or at this website. And she's going to talk about what to eat. She's going to send you handouts. She's going to send you videos. Watch those videos. She may meet you at the supermarket, take you shopping. You eat plant-based like she is suggesting, and let's rendezvous back here in a month. Let's see if you're not leaner and healthier, and we'll talk about getting off the medications you're on. That's how medicine should be practiced in the 21st century. We got to stop holding the dietitians at arm's length as an afterthought and welcome her or him onto the primary care treatment team. She belongs there. That's the arrangement at the Aroga Lifestyle Medicine Clinic, where I now work up in Victoria, BC. The patient sees the Aroga physician, and the next stop is the plant-based dietitian, where they are given a plant-based food plan. So where's the doctor and the patient supposed to learn about this? Fortunately, there is plenty of information free for the taking. Go to plantricianuniversity.org. You'll find no end of courses there on how to use plant-based diet to reverse disease in every stage of the life cycle. University of Winchester has a great online course, 6 weeks on plant-based nutrition. I took it and learned a ton. There's going to be excellent books for clinicians, plant-based nutrition and clinical practice. There's now a medical journal devoted to disease reversal. It's a thing, disease reversal. And it's a free journal. Anyone wants to subscribe to it, they can. But this is the sign of the times. The American College of Lifestyle Medicine is very pro plant-based. They know that it can reverse disease. And this most powerful clinical tool any doctor can ever wield. Here's my patient's Ken, my patient Ken, who, the doctors say, Americans aren't going to change what they eat. Yes, they will. They are tired of being sick and tired. Ken came in looking like this on 2 medications for blood pressure and diabetes meds. 12 weeks on whole food plant-based diet. He lost almost 20 pounds, normalized his blood pressure, blood sugar, and got off his medications. So where do you start? Where do you make, well, what do I do, doc? There's wonderful introductory programs. If you've not seen a film called Forks Over Knives, please go to the forksoverknives.com website. The fork is your dinner fork. The knife is a scalpel going down your chest for a bypass. See the video there, see the film at the website. You'll see people transforming right before your very eyes on a whole food plant-based diet, getting rid of their diabetes, etc. And then come back to the website. They've got recipes and transition plans, but so do other programs. The Plant Strong folks have a great meal plan. Rochester Lifestyle Medicine has a 15-day jumpstart. It's just excellent. Physicians Committee for Responsible Medicine has a 21-day kickstart. It's available. Seek and ye shall find. There's lots of friends and colleagues cheering you on. We're just about at the end. Doctors who choose not to let nutrition become part of their practice are condemning themselves to be the medical version of the blind men and the elephant, where each blind man is a different part of the same elephant, but none of them understands what the whole elephant is. The same thing medically, the cardiologist is in his cubicle treating the clogged arteries, the endocrinologist is in her cubicle treating the diabetes, the gastroenterologist in his cubicle treating the Crohn's disease. They don't realize they're all treating the same. The effects of the patient's meat and dairy-based diet is what they're really treating. And the tragedy is none of them understand that if they get the patient on a plant-strong diet, these diseases go away. People say, well, there's barriers. We live in a food desert. I don't know if you know, and it's expensive to eat this way. And there's cultural tradition. My patients are Hispanic. My patients are Filipino. They eat meat and cheese. That's what they do. And it's not for me to talk to them about their cultural traditions. Yeah, but most ethnic traditions have a long history of healthy plant-based cuisines. The Italians certainly know how to make pasta primavera and wonderful plant-based dishes, risottos. Just do a search on low-fat plant-based Italian recipes, and your screen will fill up. The folks from South Asia know how to make wonderful curries and dals and tikka masalas based on plant foods. The folks in Latin America can make burritos and tacos and enchiladas on completely plant-based fare. The Asian folks have wonderful noodle dishes. This is not a transgression. This is an accentuation of the foods, the health that they have a tradition of eating. Well, it's expensive to eat this way. That's another myth. It is not expensive because the staple foods that provide the most protein and the most calories, the rice, beans, potatoes, lentils, they're cheap. You can buy a 10-pound bag of rice for a little over $6.50. 10 pounds of lentils set you back less than a little over $12. 2 cups of rice, 2 cups of lentils will give you enough protein for any adult for the day. And that's not all you're going to be eating. But make these bulk purchases of rice and beans and potatoes, etc. Make up these big stews and soups, and freeze half of them and eat the rest over a couple of days. You only have to cook like twice or three times a week, and get the people involved in the food preparation, and find that a little love goes a long way. So for the medical schools and the students and the residents, I say regard my talk as a report from the front lines of medical care. People are dealing with these obese, diabetic, hypertensive patients, and looking for their genetic problems. I'm here reporting back to the reinforcements, the young docs coming into the battle. It's the food, and that your patients are eating. It's been the food all along. And very importantly, these are reversible diseases, not lifetime curses. And a plant predominant diet is the key to reversing them. So at the end, when I'm talking to the medical students and the residents, I ask a provocative question. So knowing how reversible the majority of diseases that you're going to spend your career treating are, with proper nutrition and healthy lifestyle practices, you want to heal these patients. You just want to manage their chronic disease. If you're just going to manage their diabetes or manage your high blood pressure, you'll leave medicine. It's a dismal way to practice medicine. They're all going to get fatter and sicker and have their heart attacks and strokes. You want to heal these patients, get real, doctor, about why they're sitting in front of you, overweight, diabetic, hypertensive, clogged up and inflamed. Get them on a plant-based diet and watch these diseases go away. So the concept disease reversal, you betcha, is breaking out everywhere. The plant-based wave is breaking. Line up your surfboard, learn all you can about it. And if you want to learn more about what we are doing, I'll leave this slide up. Go to Moving Med Forward. I'm sorry, this should be .org. Nah, boy, nuts. I wanted to change that. This is movingmedforward.org, or go to my website, drklaper.com. They'll both give you information on our work there. And in fact, if we click on Moving Med Forward, this is what you get. And again, it's movingmedforward.org. So I'll leave this slide up for you. So this is basically the message: is show me the science. I showed you the science, and it absolutely is a reversible disease, and we should take advantage of what a whole food plant-based diet can do. So let me stop the share and open this up for questions if anyone has any.
Great. Thank you so much, Dr. Klaper. Always a pleasure. You explain things in a very clear and concise way. So I appreciate that. So, all right, so you shared information on how everyone can get in touch with you. So that's great. So I think one of the issues that is challenging with regard to this type of information pervading the medical system is the idea that the medical system is so designed to profit off of illness. How can doctors have a profitable medical practice with nutrition-centric medicine?
Oh, such an important question at the crux of so many of our problems, this real bottleneck. Because I mentioned that with doctors, I don't get paid for it, I don't know how to do it. Um, so, but like my high school basketball coach said, you got to wanna, okay, you got to really understand it. This is important stuff. You want to heal your patients, you got to find a way to get this information to them. Fortunately, there are now, people go to the American College of Lifestyle Medicine website. They have extensive information there on how to have a profitable practice with this. There are going to be more and more doctors with a big lifestyle component in their medical practice. And some of it is going to come down to creative billing and have the billing person. There are ways to do group visits, and you can bill, you see 10 or 15 patients at a time, all your high blood pressure patients or all your patients with diabetes. You see them at a group visit, and you get to bill for each one of them, even though you only spent an hour. So that magnifies the billing. The dietitians, many of them are now able to bill the insurance companies directly. There are ways for money to find its way to the people who are willing to do this. but you got to want to do it. But it's available. Go to aclm.org and go to lifestylemedicine.org and find, and the Plantrition Project also has good information on how to make a nutrition practice profitable. So it can be done, but it takes a little work. Hopefully, we'll make it easier as time goes on.
Well, that's great to hear because it's obviously a huge hurdle. I just also want to throw in Dean Ornish's program. Isn't that covered by Medicare now as well?
Yes, the nurses program covered by Medicare. I heard let's see, it was at Michigan State. They had it in there, but it wasn't turning a big enough profit, so they ended it. You can't look at this as a profit-making endeavor here. Medicine should not be profit-driven there, and so. You want to get people screaming loud and long, do not discontinue this. It takes community involvement as well.
So I think most people, or at least historically, have had the idea that with regard to diabetes, sugar was actually the cause of the disease. And to the point where I think I heard Dr. Neil Bernard probably for the first time explain that it was actually the fat, and it was really kind of shocking. Is that actually beginning to pervade the medical system, and the doctors beginning to understand that?
Slowly, and it's embarrassing. And I use this word often during the week. I'm embarrassed by my colleagues, and it's not their fault. There's this black hole of nutritional ignorance right in the heart of medical education that lets these doctors graduate not understanding what they're looking at with these chronic diseases. And doctors fall, oh, diabetes, sugar, diabetes, and you learn on the wards. Oh, if your patient's got a blood sugar of so much that this is how much insulin they need. It's just a matter of just driving those sugars down, and that's diabetes to them. And oh, it's some oh their pancreas is funky. Yeah, that's the problem. No, doctor, their pancreas is putting out lots of insulin. That's not the problem. It's the insulin receptors. And slowly, this is probably working its way up. Next time I lecture a group of medical students, I will ask them what are they being taught about it. But it's embarrassing that they're not. This is not being trumpeted out. To certainly to all the doctors in training. But really, this should be on highway billboards. It should be on TV commercials. You should have sports stars talking about this. You should have movie stars. I used to be diabetic, and it turned out to be the fat I was eating. Well, I went on plant-based diet, I've lost weight, and guess what? My diabetes went away. What if LeBron James was saying that? What if Taylor Swift was saying that? Not that they had that, but we need to educate the population about these things. It should not be kept a secret, that's for sure.
So given that diabetes is actually an issue with regard to the amount of fat in the cells, is there any sort of blood lab work that can be done to measure that?
Oh, well, certainly. And again, your hemoglobin A1C is a rear view mirror of your average blood sugar over the past 12 weeks. And if you're eating lots of artery clogging fats, you're also clogging up your insulin receptors. And if your hemoglobin A1C, if that's the percentage of hemoglobin in your blood that's sticky with sugar, that's glycosylated. And if more than 5.7% is glycosylated, you've got prediabetes, and if more than 6.5%, you've got frank diabetes. And so, that's the simplest, cheapest, quickest way. And just assume my insulin receptors are clogged up with fat. That should be the conclusion that comes from that. And I see there's a few questions about olive oil, et cetera. Well, it's another reason why we're not big oil fans, because they're fats and they can work their way into the cells and they can make insulin resistance worse for that reason. But yes, check your A1C, and if it's elevated, look at the fats in your diet because that's what's clogging up your insulin receptors.
So speaking about oil, there's this idea that seed oil is uniquely bad for you. I'm sure you've heard something of that.
Right.
What are your thoughts on seed oils in particular? And does it really matter if all oils are bad?
Yeah. Um, doesn't matter. It might be a distinction without a difference. But the issue is, there is an issue with certainly the seed oils. What are we talking about? We're talking about the cheap industrial oils. We're talking about peanut oil, cottonseed oil, sunflower oil, safflower. These are the cheap oils that the potato chips are fried in, that the French fries in, and McDonald's before they went to beef tallow, like that's healthier. That fryer oil gurgling and bubbling and boiling all day. There's cottonseed oil or sunflower oil. And as those oils are heated, the molecules of fats break up and you get these fragments of oxidized oils teeming. The ends are like a bloody stump teeming with free radicals that are missing electrons. And if you eat them, and that's what a French fry is, a sponge for the fryer oil. The onion rings are sponges for the fryer oil and teeming with these free radicals that rip electrons off the cells in the back of your throat and your esophagus as it's going down. They're really nasty oils, and using them in a candy bar or in a frozen dinner, same thing. They oxidize easily, and it's the oxidized oils that are oxidizing, and so that's the main problem with the seed oils, and they're cheap industrial oils that are oxidizing. Um, the so that's all I'll say about those. But go ahead. What's
But
your
no, no,
question?
I was going to say, because I've asked this question of, multiple doctors, and I think you're the only one who really gave a clear explanation of why the seed oils are uniquely different. Everyone else kind of was more like, well, oil's bad for you, doesn't really make a difference. But you're saying all oil is bad, and these oils are worse because of their oxidative power.
Yeah, absolutely. Yes.
All
The
right.
skin oil is easy to break up with
All
heat.
right. Well, I really appreciate you making that clear. Is there a program for you to teach doctors? I believe at one point you were doing
Yes,
that.
that's what I'm doing basically. My day job is at a Roga Lifestyle Clinic, but my passion is going to the medical schools and reaching the medical students before pharmacosclerosis gets into their brains and they think that drugs and surgery are the only treatment for these diseases. So before COVID, I was living in airports and hotels going from med school to med school. Now, a gift from the COVID virus, we do most of them by Zoom. And actually, I'm reaching more medical students than ever. And so that last slide was me teaching at the University of Florida medical schools. And if people would like to find out and even support our work, because it's expensive, go to movingmedforward.org and find out what we're doing. But yes, that's my main passion with the rest of my career. I want to reach as many young doctors as possible. And it's the food your patients are eating and get that message into them.
And as you go about training doctors and you also talk to the general public, who do you find is more receptive to this message? Are doctors more receptive? Are the the possible patients more receptive?
What a great question. To my dismay, I have to nowadays, and it might be selection bias. The people who are listening to my lecture are obviously open to nutrition, I guess. But the public is way ahead of the doctors. That's why they're so frustrated. Why doesn't my doctor know anything about nutrition? The doctors are the one lagging behind. They say, I've got so much to learn in med school for anatomy and physiology. Don't ask me to learn about nutrition. Yes, doctor, you need to learn about nutrition. But among the younger med, that's why I want to talk to the first and second and third year med students before they get this locked in idea that drugs and surgery are the only treatments. The young med students, it's getting easier with them because in every med school class now, there's 10, 20, 30 students. They've seen Forks Over Knives. They've seen What the Health. They've seen Cowspiracy. The light's on for a lot of them. They want a senior doctor to stand in front of them and say, you're not crazy. It's the food, and you can reverse these diseases. So the young docs and the young students are very open to it. But there's always some professors in the back of the room with their arms folded, shaking their heads, and they don't want this. This threatens their intellectual model as far as the cause of disease, and it threatens their financial model, threatens their treatment model, bringing a dietitian in on the primary care treatment. This is disruptive concepts, but it's the way medicine has to go in the 21st century. We need to be talking about food because these are foodborne diseases.
And does your teaching of the medical students, does that go through the medical school, or are you doing it outside of the medical school?
We go outside. The administration does not want to hear from Dr. Clapper. They don't want to hear this message. It is so disruptive. But as I mentioned, in most hospitals, medical schools now, there is a lifestyle medicine interest group. There are young docs and residents who have already become aware of lifestyle medicine. So we go right to them. We go right to the students and to the residents, and they bring Dr. Clapper in. They organize the event, and we just do an end run around the faculty. I don't have time to. They're not interested. That's fine. We go right to the students, and they are very interested. And if any listener, no, I've got a cousin who's med school. Go to our website, Moving Med Forward. We have a contact page that says if you have a med student or a doctor attached to a medical school and you think they would be interested in this message and have Dr. Clapper give this talk, tell us who you are. And so if you'd like to bring me into your med school, go to movingmedforward.org and you can contact us. We'll be glad to connect.
All right, great. What is the role of salt in health? And you now in the last, I don't know, 10 years, maybe it's even been longer. You have all these mineral salts and, Himalayan pink salt is supposed to be so much healthier than table salt. Can you talk about health in general, and then more specifically, are these salt types more healthy?
Last part first, no. The salt is salt, okay? And whether there's some magnesium or some potassium or whatever, that doesn't matter. You're not using salt for the minerals. That's what you're eating vegetables for. That's what you're eating fruit for. That's what's in the salad. That's what's in the vegetable soup. Um, that's where to get your minerals. It's not out of the salt shaker. So all the marketing hooey that's around these various types of salt, it's salt, and the more we're learning about it, the more problematic it is. It really increases the risk of so many diseases, heart attack, stroke, heart failure, etc. But even autoimmune disease. We use too much salt. It's a rarity in the natural world. That's why the cows come to the salt licks because by and large, mammals do not have a lot of sodium going into their tissues, but it's in the veggies, it's in the grass, the celery, the dark green vegetables. There's enough sodium in the food. There's the rare person who and these are usually skinny vegan women, bless them. But I'll get a 98-pound woman who's lost a bunch of weight, who runs a normal, very low blood pressure. Her normal resting pressure is 90 over 60, and she'll stand up quickly, and her blood pressure drops even lower. She gets lightheaded. Yes, she could use a pinch of salt with her veggies to increase her circulating blood volume, but that's the exception. By and large, the salts in the food and putting more salt just increases your risk for a whole bunch of diseases that you don't want. So less is more when it comes to salt there. Don't be fooled by the marketing.
So is sodium uniquely bad for you, or is all minerals, really could be bad for you if you overdose them, and we just happen to overdose with sodium?
Very astute, well phrased. Yes, that's the issue. Sodium, we need these minerals. Sodium is essential for life. Without it, you die. I mean, every one of our cells has sodium in it. We need it. But as I said, it's in the veggies. The gorillas don't salt their food. It's in the leaves and the vegetation they're eating. And and as you said, all minerals, if you eat too much of them, become toxic. That's true. Get it out of whole foods, which is the point there. If your food stream is steady whole foods, the vitamins and minerals will be there for you. You don't have to add extra sodium to that. And yes, sodium becomes really problematic when you eat it individually in table salt.
And what about potassium chloride as a substitute for salt, given that it doesn't have sodium?
Yes, absolutely. Very legitimate substitute. Actual table salt is sodium chloride. It's a sodium atom and a chlorine attached. Well, you can take out the sodium, put potassium on there, and you get potassium chloride. And it tastes salty. It has a little strange aftertaste to it, many people find. But it's absolutely legitimate. I'd much rather people eat, because we are short of potassium in general, because we eat so few vegetables, that I'd rather people sprinkle a little potassium chloride on their salt on their veggies than sodium chloride for sure.
And what about iodine?
We need it, and especially if you're vegan. I've been vegan for 46 years here. We don't eat fish, and iodine is absolutely essential for our thyroid gland to function, which is needed for life. And so you got to find a way to get some iodine into your diet. I think some of the fatigue that long-term vegans may feel, and some of them, it's subclinical hypothyroidism from iodine deficiency. And so you can get your iodine checked with a 24-hour urine test. But if you just want to cover it there, make sure 3 times a week you have something with iodine in it. And some of the more benign forms are some of the organic sea vegetables, wakame, the green vegetable in the Japanese restaurant salads there, arame, the black seaweed, some nori, chewing up 5 or 6 nori sheets. That'll supply do that a couple times a week and you'll meet your iodine needs nicely. Um, if, uh, if you are that skinny vegan woman who needs to add a little table salt, make sure it's iodized, that they put iodine in there as well. And if you're taking a multivitamin that many vegans are, it's not so crazy to get enough vitamin D these days, get enough zinc. Make sure it's got 150 micrograms of iodine there. So get it out of either vitamin supplement or sea vegetables or iodized table salt if you use it.
Is there an upper level on that? That may
Yes, the reference amount is 150 micrograms. Those are millionths of a gram. You can take up to three, four, to up to 1,000 micro, up to 1 milligram. That's as far as you want to go, and I'm more comfortable. 500 micrograms is the upper limit.
very great. And what if someone has a really good diet? They are, seemingly doing everything right with regard to a whole food plant-based diet. Their SOS and their cholesterol is still high. Does that type of person who, all indications otherwise are really great, they're over 200 with their cholesterol, do they need a statin?
Um, I don't think so until you've done some testing to see whether that elevated cholesterol really is a problem for them. First of all, make sure again that you're not looking at subclinical hypothyroidism. One of the effects of low thyroid function, your cholesterol goes up. And so make sure that your thyroid, your TSH level is nice and low, and that there's enough iodine in your diet for your thyroid to function. So that's square one. Um, Second is check out the amount of saturated fats, and then vegan candies and cookies and things have saturated fats that slow down the liver's ability to get rid of cholesterol. And so does too much fructose. So check out your diet that you don't have hidden fats that are inhibiting your cholesterol excretion. So these are just common medical issues, but they're often behind these elevated cholesterols. Once you've cleared that out, the person really is eating a whole food, plant-based diet, rice and beans and greens and fruits and vegetables, etc., and that cholesterol is still up, then you have to decide, is it doing any harm? And because the formation of plaque in the artery walls from oxidized cholesterol molecules getting in there, as I showed you, it sets off inflammation. So I'll find out, check your inflammatory markers, check high sensitivity CRP, check one called myeloperoxidase, MPO. And if there's any question and it's serious, to go on statins or not, ask your doctor to send you over for an ultrasound scan of your carotid arteries and see if there's any plaque forming there. If they are crystal clear, if your artery walls are pristine, no sign of thickening or plaque formation, your inflammatory markers are low, and your oxidized cholesterol is low, then you don't have the disease of atherosclerosis. It's a benign hypercholesterolemia. It's not doing your arteries any harm. And the question really isn't how high is your cholesterol. It's how healthy are your artery walls? Or are you developing plaque in there or not? And if you're not, if your inflammatory markers are low, oxidized cholesterol is low, your scan is clear, you don't have the disease. I wouldn't go chasing that with statins. Keep your diet clean there, but only if if your inflammatory markers are up, oxidized cholesterol is up, you're starting out thickening there, yeah, you're developing the disease there. do something about it. Clean up your diet, full tilt, boots in, and yes, and you might need 6 months of statins or 12 months of statins, but unlike most cardiologists, I think that's another time limited prescription. Do it for 6 to 12 months, and then clean up your diet and get off them. It should not be lifetime medication. There's no reason vegans should be having heart attacks and strokes.
And calcium score scans have become very popular. People are a lot more aware of their calcium score. What are your thoughts on the effectiveness of a calcium score?
Yeah, there's a message in your calcium score, but it's not necessarily the evil one that people panic about. Um, when there's inflammation in the body that is chronic, it lasts months and months and months. If you've got a bone spur rubbing on a tendon and that tendon is constantly getting inflamed, after a while, your body, to stop the inflammation, will deposit calcium. It petrifies it, it walls it off. It's part of the body's way of dealing with a focus of chronic inflammation. Well, as I mentioned, plaque formation in the coronary arteries is an inflammatory process. And if this is going on months after months, years, after a while, the body's going to say, enough of this inflammation. You're going to pack it up with calcium, petrify it. And that's what these flecks of calcium are. And if I can do a little colorful analogy here, a few years ago, I went to the site of the Gettysburg National Monument, the battlefield there, and you go into the visitor center, and there's this huge diorama, half the size of a tennis court, and there's thousands of little plaster soldiers, half painted blue, half painted gray, and they're in their battle poses with their knives and their guns, etc. But these are plaster images frozen in time, reminiscent, evoking the battle and the past. And that's what these calcium flecks are. They are leftover remnants of the inflammatory fire that was burning there years ago, months and years ago. So what's the message? It says, yes, you have a body capable of producing plaques. Absolutely. You're at risk, sir. But again, if you've already cleaned up your diet and you're running rice and beans and greens and fruits and veggies through your arteries and your inflammatory markers are low, then you've stopped that process. It was a warning, it was a shot across the bow. But if you jump on Dr. Essel's program, keep your diet whole food, plant-based, it should not progress, and it doesn't have the same import as Joe Cheeseburger eater and Buffalo wing eater. He's cruising for a bruising. But if a person jumps on the plant-based train and treats their arteries nicely, it's a warning, but it doesn't necessarily mean, oh, you got to be on statins, you're going to have a heart attack. Not necessarily. It's a sign that your arteries need TLC.
So a question that I've asked you in the past is on DHA and EPA supplementation. Given Dr. Fur, all right, well, I guess I know where you're going with this, but given Dr. Furman says that we don't convert it very well, and I know that you had taken it for a little while. I think maybe you had gone off. Where do you stand on that issue? Should people in general, if they're getting enough omega-3s through flax seeds, chia, walnuts, etc., should they be concerned with their conversion and take a supplement?
Um, yes, I've gotten concerned about, since with Jeff Nelson, all that stuff went on, and he locked in on. It turns out there've been a lot more studies come out about the importance of DHA as far as maintaining brain health, et cetera. That I just spoke with Dr. Sherzai, who also is an advocate of it. It's still a gray area, but yes, I've reluctantly started taking the DHA again. And about 3 times a week I take it, probably not enough for Dr. Furman, but I've reluctantly started taking it again. But every week I've got my eye to the literature, and every week a study will go by saying, yes, it's absolutely essential. And then I'll get another, we don't need to do this. You got plenty of DHA on your stored in your body. And I've got 2 stacks of studies growing here, both, and I'm looking both of them, still shaking my head. I've kind of reluctantly been pulled back into the supplement side and hoping it does good things about my to my brain as the years go by. Someone mentioned, does Dr. Klaper do video consults across the country? Yes. Go to my website, drklaper.com, and go to the contact page, and you can arrange a video consultation with me. Absolutely.
All right, great. Is there a range for DHA that if we have it, for within that range, we don't need to supplement?
Yes, I literally spoke with Dr. Furman. In fact, Joel and I were on the same broadcast last week. And before we went on the air, I asked him, so any study? He says, yeah. He says, you want your omega-3 index well over 4, probably in the 5% range there. So for whatever use the omega-3 index, and he says there seems to be, you want it well over 4.0. Um, but again, most of the concern is that the lower folks with lower omega-3 index have a higher risk for heart disease, which vegans are essentially immune from if they do it right. But Joel says no, if low omega-3 levels do correlate with less resilience in the brain as the years go by. So try and get it up over 5 there.
And have you noticed any clinical changes since taking the supplement?
None. No. Not a thing. No.
So you want it to be like a supercharge your brain, but you worked at True North.
Yep.
I'd love to hear what you have to say on fasting in general as something that people can work into their lives as a health modality, also as a treatment for specific issues and intermittent fasting.
Yes. Fasting is an amazing state. The body shifts after 48 hours with no carbohydrates coming in. The body starts burning off its own fats, and a lot of other changes happen in the body. The cells start cleaning themselves out of cellular debris. Anti-inflammatory vitamins start appearing. Sirtuins with anti-cancer properties start appearing, and it's very beneficial to stay in that state. Certainly, you wake up in a little bit of that state every morning, so extending that during the morning hours instead of running down to the kitchen at 7:30 in the morning and shoving a bunch of sugar into your mouth there. Keep that fasting, that nighttime fasting state going through the morning hours, 9, 10, 11, and you'll get 3 or 4 more hours of cellular clean out and anti-inflammatory activity. So the intermittent fasting, though it's really time restricted feeding is the proper term for it, is very beneficial. We spend too much time eating. But people who, especially if they have a health problem of high blood pressure, diabetes, whatever, or they just need a good clean out, to start with just say a 72-hour weekend fast on either water, but you can do it on vegetable broth as well, from Friday dinner to Monday morning. And take it easy that week, but just drink fluids during the week. That'll give you a nice clean out, and you can extend it out to 5 days. More than 5 days, you should probably have medical supervision, which I will be happy to provide. I do fasting supervision over the internet. If people would like to arrange a 3 to 5 day fast with me looking over them, I'll be glad to arrange that. Again, go to drklaper.com. So fasting has a place. I have a real issue when people want to stay in that state of ketosis month after month. The ketogenic diet and all that stuff is, to me, makes no medical sense, and I think is dangerous. But just to spend 3 days or up to 5 days in ketosis, I think to do that once or twice a year, I think would be a very healthy reset for most people.
So I got a few things. One, eating window for
Yes.
time restricted eating. What do you recommend?
What about eating
The eating window.
window? Yeah. Um, when you start, as I say, if you can hold your first morning meal off till 11 or noon, and then let the eating begin, and all the way through the afternoon and early evening hours, by 6 or 7 in the evening, like Dr. Furman said, the restaurant is closed. Be done with eating around 6 or 7. So that gives you a 6 or 7 hour window. You can make it up to 8 hours if you start at 11 in the morning down to 7 in the evening. but don't be sitting in front of the TV at 10 o'clock at night shoving vegan donuts into your mouth. That really puts a stress on the body there. So hold your eating window to 6 to 8 hours.
So we've had some of the doctors actually recommend an earlier window that supposedly you actually burn more calories, even eating the same number of calories when you eat earlier in the day. I guess your body, and this may not be the exact mechanism, but your body heats up to convert to calories earlier in the day at a certain time. Um, does it so? Okay. All right. Says no. All right.
Yeah, we're talking about whole plant foods. Whether you have a salad at 10 in the morning or 2 in the afternoon, it's a salad. I don't think calorie burning is that much of an issue. And if you're trying to lose weight, might be an issue. But again, keep your belly full of fresh fruits and vegetables, and that weight's going to come off because the calorie density is so low. I don't think it matters a whole lot when you eat it there.
And I think we had one doctor who does a lot of fasting. He coached people on fasting, and he said that it wasn't until day 7 that a lot of the medical treatment actually occurs. So you get the detoxing, but if you really want to undo, or I'll let you speak to it. You know where I'm going.
Yes, absolutely, and he's right. And people would come to North and they would do these 21-day fasts or longer, and because they had, honest to goodness, they had runaway high blood pressure, their joints were hot from lupus, they had an official medical issue, and 5 days would not be enough for these folks. And as we got them into a real fasting state, finally about day 7, sometime by day 10, the walk in. And you see, I had one lady on day 12 of a fast. She had bad rheumatoid arthritis. I came in, she had tears going down her face. I said, "Are you in pain?" She said, "No, this is the first time I've been able to open and close my fist in months from my arthritis is gone." And so you see the blood pressures drop on day 15 sometimes. So yes, if you're really trying to get a real medical effect, yes, sometimes these longer fasts are required, and you should be under the care of someone who knows how to supervise the fast. Either go to True North or connect with me, and we'll because when I supervise a fast, I want to see you every morning on my cyber screen here. And are you okay? Are you getting lightheaded when you stand up? I'm hovering over you, whether it's in person or remotely. But yes, sometimes the medical effects take quite a while to kick in.
And this specialist who helps people with fasting, he actually believes in the efficacy of, so he was doing a 21-day fast with one of his patients, and within that 21-day water fast, he had periods of dry fasting.
I am not in favor of dry fat. We need water. Your kidneys need water. You are excreting waste. Do not deprive those kidneys of the water they need to get rid of those waste. Your blood will hemoconcentrate. The concentration of those wastes will build up. I am not a fan of dry fasting. Period.
No, he talked about with regard to that because there was a panel that between Dr. Alan Goldhammer, and Dr. Tillis, I believe his name was, and he was saying that the body has metabolic water that'll actually pull out to flush to flush that out. Any thoughts on that?
Um, yeah, some water, and people notice on a fast they often drink less because of this phenomenon. As the fat tissue is metabolized, yes, molecules of water are released, and yes, there is a metabolic water. But would I bet my kidneys on that? Would I bet my retinal blood flow on that? Because the blood will thicken, it gets more viscous. That's scary business to me. I don't see any advantage in doing that. I think it's a real stress on the tissues.
So our next speaker is running a little bit late. Do you mind going for another possibly 15 minutes?
Of course.
All
I,
right, beautiful. So, um, you hear in the plant-based world, that some people are whole food plant-based, and then all of a sudden they say, you know what, I'm having issues, and I have to no longer be plant-based. I need to eat meat. Can you explain from a medical perspective what that phenomenon is?
yeah. I think the vast majority of them, the issues, and they're not negligible. But there's social issues. They got tired of being the odd man out at the restaurant. Their spouse is not on board. They don't like the chopping and the cooking of the veggies. It's inconvenient. They don't like you're a vegan. They don't like that whole label. Whatever, there's reasons that people, it's just easier to cave in and just order the burger and get on with your life there. And so I think most of it is just non-support from their social environment. Um, if the person is really, I'm vegan for the animals and this is killing me. I don't want to even think about eating animal, but my body's not doing well. Then you need a consultation. Then someone need to connect with me or Dr. Goldhammer or somebody at True North, or there's really good plant-based uh, resources available. Send me a 3 or 5 day food diary. Let me see what you're really consuming. Let me see your most recent blood tests. Let's get a fresh set of blood tests. Let's find what's going on because the human body should be able to thrive on this. And if you're really not, I need to know what you're really eating and how your body's responding to it. And so it's not an insolvable problem by a long shot, but mostly I think people just they cave to the social pressures.
So you talked about Ozempic during your talk, and I've heard that there is a lot of the weight loss is actually lean mass being lost. Can you talk about that? And does that lean mass, once it's lost, the people go off and they regain the weight, do they just regain the lean mass back as well?
If they work. This was a really disturbing thing that I just learned a few months ago about this. But as that weight comes down, when they did the DEXA scan that can determine fat tissue, lean tissue, water tissue, and the tissue, etc., people were shocked and concerned that yes, you lose fat, but boy, you lose muscle as well. And once you start eating again, well, certainly it's easy to get the fat, but it depends what you eat, of course. But if you've lost significant muscle and people are on this thing for 6 months to 12, 18 months, you're going to lose significant muscle. Man, you got to both increase your protein intake moderately. Don't make yourself protein toxic like some of these people are doing. But you need to use those muscles, whether you actually physically go to the gym, but even at home with the elastic bands and the trainers and the hand weights and working down in the fitness room in your apartment, man, you got to get work to get those muscles back. This drug is a deal with the devil. And we want that easy fix. Oh, give me the pill and lose the weight and everything's fine. Well, no, sir or madam, it's not fine. It's going to cost you muscle, and you got to work to get that back. There's nothing for nothing in this world, including weight loss like this, unless you just go on a plant-based diet, which is all you really need to do.
Yeah, it reminds me of the saying about having to give up a pound of flesh. Or no, I guess in this case it's a pound of muscle. So what are
Mhm.
the consequences of losing muscle at that, at such a, I mean, because if you're losing, let's say you lose 30 pounds, and I've heard up to 40% is, I've heard lean mass. I don't know if it's all muscle, but let's say you lose 30 pounds and even, it's 20% muscle. That's 6 pounds of muscle. What are the long-term consequences of losing that much muscle as we age?
Oh, very astute question. And like everything else, the body and its various components are like the concept from mathematics of fractals, these wonderful patterns. And the closer you look, the more it breaks up into smaller and smaller pieces that each have their own features. Well, we're learning that muscle, like every other tissue in the body, is not just about lifting boxes here. It's an endocrine organ. These muscles secrete hormones, myokines, that help your brain function, that help appetite regulation. And the more you let those muscles wither, the more you lose your connection, both this neural and this endocrine connection. But also, muscles are needed to keep your bones strong. And because as the muscle pulls on the bone, it stimulates the osteoblasts, the bone building cells, and so you lose muscle mass, you're going to lose bone density. You're going to be more prone to osteoporosis. And you'll find it's harder to get out of chairs. It's harder to walk upstairs. You will notice the loss in muscle mass. And there's just less of you there. And And if a person's been obese, their leaner self starts emerging, but it'll be a weaker self. And rather than if you had just gone on a freaking vegan diet, plant-based diet, and lost the weight honestly through low calorie density soups and salads, whatever, you'd retain your muscle mass, especially if you emphasize the higher protein foods you have. And I tell the plant-based eaters, make an art form of getting legumes into your diet, preferably at least once a day, but at least every other day, numerous times during the week. Well, what does that look like? Again, anything in a pot is a legume: beans, peas, chickpeas, lentils. So a bean burrito, a tofu sandwich, a hummus sandwich, a lentil stew, anything, bean chili, anything that's got legumes is money in the bank for you as far as your protein intake. So keep that protein intake up. Get on a plant-based diet. Let that take the weight off you. I think the Ozempic. This is a sad commentary on modern life these days of our laziness, of our and cowardice. And it's not of the people taking the Ozempic. It's of the doctors, it's of the public health people. They're afraid to speak the truth. It's the food. Stop eating the burger, stop eating the buffalo wings, stop eating the KFC. That's the problem. They don't have the cojones to come out and say that. And so they come up with these drugs, these that come in the side door with all these nasty metabolic costs of your muscle mass, of your stomach function, and you hook the people on it because they can't get afraid to get off of it, and it's so cynical and unnecessary. So yeah, you lose muscle mass, but I think you were losing a lot more than that. It's a sad, it's almost a tragic drug that we've come to this. So many people are on it, and there's Wegovy commercials. You join your tribe. All of the Wegovy users. I feel I'm part of my family now. Everybody else is using Wegovy. Yeah, it's a sad state of affairs. Fine kettle of tofu. Yeah.
So, there's the joke in the plant-based world of where do you get your protein? And you were just talking about, getting beans in your diet at least once a week for protein. And a lot of doctors will say you don't need to even worry about the protein. If you're getting enough calories in your diet through plants, you'll get between at least 8 to 10%, I believe, of your calories in protein. Are you saying that we should worry about protein or on a plant-based diet, or are you saying specifically in this case it really becomes important where people lost muscle and they need to rebuild and grow their muscle back?
Right. Well, we're just learning, the studies I'm reading is that especially as we get older, that we
Right.
need a
Okay.
little bit more protein there. And I'm 77, and I guess I'm officially in that category. And we're just talking about another scoop of lentil stew, another hummus sandwich. It's not neurotic here, but just bump up your protein a
All
little
right, so we
bit.
don't need to drive ourselves crazy. You
Yeah.
you look amazing. I hope I look half as good at 77 as you do. So all right, so someone is asking if a person is losing too much weight on a whole food plant-based diet and needs to gain weight because they have cancer, what's a good nutritious supplement they're asking for gaining weight?
Oh my. You really need to work with your doctor. The problem is the cancer. It's not the weight loss per se. And the reason there's a delicate answer here because my colleagues, my conventional colleagues in cancer care, in oncology, and all their patients and the family who watches the cancer patient who they love, they witnessed this horrible spectacle called cachexia, where the person just with the cancer just gets so skinny, 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 and they eventually wither away there. And so, from ancient times, but certainly I remember when I was a kid growing up and people in the family had cancer. Oh, eat, eat, and they would feed them all these high calorie foods, steak and ice cream. Well, we're now realizing that is feeding the cancer. Actually, the cancer saying, great, more steak, more ice cream, and it brings in more growth factors, more protein, IGF-1, it stimulates mTOR, does all these things in cancer's favor there. And they die faster, despite everybody feels like a failure because they didn't put the weight on. So I'm hesitant. I don't want to engender a vegan version of that. where, oh, just eat more protein shakes and smoothies and all that, and you'll gain the weight. How do we know we're not feeding the cancer? You've got to really work with the oncologist there. And nowadays there's such getting to be such good cancer therapies, the immunotherapies, et cetera, that really can hold the cancer in check. So good nutrition can put on a healthy muscle mass there. So again, you want to work to get the cancer in check. Once you do that, then yes, you can up the lower protein, higher calorie foods, more avocados and olives and raw coconut, and more beans and peas, etc. I'd stay away from the protein powders. Those I think boost up IGF-1 levels too much, not in the favor of the cancer patient. But it's a tough problem, no doubt. And if you've got a nasty carcinoma of the lung or a osteogenic sarcoma of the bone there, those are ornery cancers there. And I can't wave a magic wand, but get the cancer in check and then go with the higher calorie density foods.
And how about nuts and seeds with regard to
Yes,
that?
absolutely. Thank you. Plays a really important role. I have a good handful of walnuts and cashew mixed nuts every day, raw rather than roasted, but absolutely, they would play an important role.
So you talked about muscles excreting hormones called myokines.
Mhm.
An organ excretes hormones, does that mean it's metabolic? Like that organ is metabolic, it's involved in the metabolism by
Oh,
definition?
absolutely. Yes, absolutely. And it's all we're holistic creatures. Every organ basically talks to every other organ.
Okay.
Yes,
So
absolutely.
okay, so all right, because I feel like in the past it was sort of like, yeah, like you were talking about kind of like muscles, just just there for strength or whatever, but it really like everything in your body is metabolic.
Absolutely. Yeah. Yeah.
Okay. And that was one of my questions, which with regard to fat, and I believe it was Michael Greger who was talking about visceral fat acting like a tumor in
Yes.
your body. Can you speak to that?
Yes. And again, I bridle a little bit at the folks, the campaign for fat acceptance. And yeah, nobody should be made fun of because of their weight and their obesity. And it's serious business and it's psychologically injurious. And they deserve our compassion and our love and our encouragement. Absolutely. There's no fat shaming here. But just strictly metabolically, that large abdomen is not inert. Boy, you've got two kinds of fats making that abdomen so protuberant. Under the skin is subcutaneous fat, and that produces estrogens. It's the largest estrogen secreting tissue in the body. And if you're a woman with a breast lump or a guy with a large prostate with a few malignant cells in there, the last thing you want is 30 pounds of subcutaneous fat pumping out estrogens into your bloodstream. That's a great way to make that breast lump or that prostate get more unstable. So that's just a subcutaneous fat. But inside the abdomen is the visceral fat, and that's a different cat altogether. That fat pumps out these inflammatory cytokines like interleukin 1, interleukin 6, and they fan inflammatory reactions throughout the body. And it makes joint pain worse. Well, we know inflammation's involved in so many metabolic and pathologic conditions. That fat in the abdomen is it's not just a cosmetic issue, and it acts like a tumor putting out. It's not your friend. It's almost like a foreign, like a alien being in your body pumping out inflammatory tissues, inflammatory molecules. Get yourself leaner, and you'll be less inflamed.
So, you mentioned Dr. Brooke Goldner during
Hmm.
your talk,
Yes, yes,
and she reversed her own lupus nephritis, and she's helped countless other people reverse autoimmune diseases as well as issues with cardiovascular disease, etc. Um, and then you hear people talk about like the perfect nutrition, right? Does the diet, so she provides a very simple diet for people to eat. Does it need to be more complicated than that? Or is that something that people could just live on forever, how she describes it?
right. Um, hard to know. We're in the early years of this, and Dr. Goldner would be, I think, the first to admit. I mean, this is a very powerful disease-reversing diet. It is a lean, clean diet. It's mostly a raw food diet. And if you've got runaway lupus, this is exactly what you ought to be eating. And you've got your kidneys are inflamed, your joints are inflamed. You absolutely, you want these raw foods flowing through your tissues 24/7. But if you don't have any of that and your gut wall is healthy and you're feeling in good balance, is there a problem with eating a sweet potato? Do starches have any role here? Is a lentil pasta terrible for you? I don't think so. And I think there is a role for these cooked starches. And with the raw food diet, you're going to spend a lot of time making salads and preparing your foods there, where when you eat starches, you don't have to do so much preparation. The calories last longer. So there's pluses and minuses. But if you've got a hot inflammatory disease, absolutely jump on Dr. Goldner's program. And your body will probably tell you once the storm is blown over and you're stable, you can probably start to add more cooked foods in. I've not been following Dr. Goldner's program lately. Maybe people are already starting to do that. I'd like to know where she stands on the starches. I should write her and find out.
So, so it's 3:15 now. Our next speaker is still not here. Or do you mind going a little bit longer? We could
No, a
take a
little
look
bit longer.
if you need one.
Yeah.
Okay. Just holler when you've had enough.
I'll give you 5 more minutes.
I'm sorry?
I'll give you 5 more minutes here.
All right, perfect. So, there's a concept of calories in, calories out, like it doesn't matter. And with Ozempic, I think that there's a concept of, well, weight loss is just weight loss. Doesn't matter, what you're eating while you're losing weight, as long as you're losing weight. What are your thoughts on that? And actually, this will be the last question. Actually, we're all good.
Good. Okay, I see Dr. Mills here. I want to see Dr. Mills. He's so great.
Yeah, he is.
Yes, I learned a lot from him. As far as that doesn't matter what you're eating out of course it matters. And this is it's a bit of a physiologic parlor trick by just manipulating your ghrelin hormones and your leptin hormones, so you'll eat less there. But your arteries don't care about that. They're just wondering what is flowing through your arteries. And if the cheeseburgers and the fried chicken and the artery damaging foods are flowing through your tissues, through your breast tissue, prostate, through your artery walls there, you're doing damage to your tissues there. You may be losing weight, but the name of the game is not weight loss. The name of the game is health. And just because the weight is coming off doesn't mean you're making yourself healthier. You may actually be brewing up some nasty diseases. So the computer guys have it right. Garbage in, garbage out. With us guys, garbage in, garbage in. There's no free lunch literally here. So eat good food and that grew out of the garden, and your body will know what to do with it, and you won't have to deal with people like me with MD after their names.
All right, awesome. Thank you for being such a good sport about staying longer. I really appreciate it. It's always a pleasure to learn from you and to be able to get to speak to you. So thank you so much. If we can unmute the audience, please, so they could share their appreciation for Dr. Claper.
And
Thank you,
Dr.
They're also
Claper.
very
Dr.
Dr.
Claper.
Claper.
Wow,
Wow,
you
you
are
are
a
a
blessing
blessing
to
to
us.
us.
Dr. Claper.
Quentin, bro.